Hello and Assalamu alaikum. Ultrascan Diagnostics. Here is the CBCT of the patient that you had requested. The area of interest is both the lower right and left wisdom teeth and their association with the inferior alveolar nerve. Starting with the lower right wisdom tooth, this is the transaxial view. As you can very clearly see, we can see that this is a glossally carious lesion. This is the crown structure. This is a mesioangular impaction. The glossally caries is actually extending into the pulp chamber. And as you move towards the apex, we can see two roots, mesial and distal. And the mesial root comes in at a minimum distance between the two is 1.5 millimeters. So this is the distance between the mesial root of the wisdom tooth to the right hand side and the inferior alveolar nerve. The tooth is very close to the lingual cortical plate and we don't have any pathologies associated with it. Moving to the lower left wisdom tooth, this is the lower left wisdom tooth. As we move towards the midline, this is also carious, glossally carious, and also close to the pulp point. As we move distally, we will be able to see that we've got two roots, both separated, and the mesial root is the tooth is positioned lingually, and the mesial root at its minimum is approximately 2.5 millimeters away from the nerve. So both these teeth, the lower right and the lower left, do not come close to the inferior alveolar nerve, and they should be fine during extraction. This is the axial view, the top to bottom view. Here also you will be able to see that the left is approximately at its most closest 2.5 millimeters from the inferior alveolar nerve, and the right side is also at its closest is approximately 1.5 millimeters away from the inferior alveolar nerve.